All right, strap in, everyone. Today we're going deep into some pretty intense medical territory, biliary disorders and oncology emergencies.
Intense is right.
Yeah, we're going to be looking at excerpts from a medical textbook chapter all about managing these conditions. And let me tell you, it gets complicated fast. But don't worry, by the end of this deep dive, you'll be able to spot those red flags like a pro.
That's right. We'll break it all down. Take that complex medical jargon and turn it into something we can all understand.
So you'll come away with a much clearer picture of these conditions and the intricate world of medical care around them.
Absolutely.
Okay, let's start with something we can all relate to. You know the dreaded gallbladder attack?
Yeah.
Ever heard stories about, like, someone doubling over in pain after a super greasy meal? That's most likely a case of cholecystitis in action. So what's actually going on in there?
Well, cholecystitis, it's basically inflammation of the gallbladder.
Okay.
And it comes in two forms, acute and chronic. Think of it like a fire. Acute is like a sudden blaze. Chronic is like, those smoldering embers that never quite go out.
Gotcha. So what starts this fire in the first place? And how do you know if your gallbladder is acting up?
Well, the most common culprit is gallstones,
Ah,
those pesky little pebbles. That can obstruct the bile duct and cause a backup of bile. This blockage leads to inflammation, swelling, and a whole lot of pain, usually in the upper right abdomen, sometimes radiating to other areas.
ouch. So it's like a plumbing issue gone wrong.
Exactly.
Pipes get clogged, pressure builds, things start to, leak and burst.
That's a great analogy when it comes to symptoms. You've got that classic pain, tenderness, and rigidity in that upper right quadrant. You might also see other things like nausea, vomiting, fever, even changes in your urine and stool color.
Wow. Okay, so it's not just a localized pain situation. This can have, like, widespread effects.
Uh-huh.
But you mentioned gallstones being the usual suspects. What exactly are those stones made of, and why do they even form?
Well, there are two main types, pigment stones, made from bilirubin, a breakdown product of red blood cells.
Okay.
And then the most common type are cholesterol stones, which form when there's just too much cholesterol in the bile. Why they form is a bit of a mystery,
Uh-huh.
but there's some key risk factors, conveniently summed up by the 4 Fs.
Ooh, I love a good mnemonic. Hit me with those Fs.
Fat, female, 40, fertile.
All right, let's break those down a bit. Fat, I get it. Obesity increases the risk. But why?
Well, people who are overweight or obese, they tend to have higher levels of cholesterol in their bile, making them more prone to those cholesterol stones.
Okay, that makes sense. Female. Is that just a hormonal thing?
Yeah, for the most part. Estrogen seems to play a role. It can increase cholesterol levels in bile and pregnancy with all the hormonal shifts
Yeah.
and the pressure on the gallbladder. That also ups the risk.
Interesting. So 40. Age is working against us too, huh?
Yeah, unfortunately. As we get older, the composition of our bile changes, and the gallbladder might not contract as effectively, making it easier for stones to form and get stuck.
Last but not least, fertile. Is this just about pregnancy? Or are there other factors?
Pregnancy is the main one, but things like oral contraceptives and hormone replacement therapy, things that affect estrogen levels can increase the risk a bit too.
Gotcha. So if you check off a few of those F boxes, it's worth keeping an eye on your gallbladder health for sure.
Absolutely.
But let's say those pesky stones do form and they start causing trouble. What are the treatment options? Is surgery always the answer?
Not always, no. Sometimes dietary changes and meds can do the trick. Think low-fat cooked foods. Avoiding things like, fried or greasy stuff. There are even medications that can dissolve gallstones.
Dissolving gallstones. That's like magic.
It's pretty cool. There's also a procedure called ERCP, which stands for, get this, endoscopic retrograde cholangiopancreatography.
Try saying that 3 times fast.
Yeah, right.
So what is ERCP?
Imagine like a tiny plumber with a camera, snaking through your digestive system to inspect and repair those clogged bile ducts. That's essentially what ERCP does. It lets doctors visualize the bile ducts, remove stones, open up blockages, even take biopsies if needed.
So it's a minimally invasive way to deal with those plumbing problems.
Precisely.
But let's say things escalate and surgery becomes necessary. What does that look like?
The most common approach is laparoscopic cholecystectomy, also known as keyhole surgery. It's minimally invasive. They use small incisions and a camera to remove the gallbladder.
And recovery. Is that a long and painful process?
It's generally faster with laparoscopic surgery compared to the traditional open surgery. But no matter the approach, careful monitoring and patient education are key. both before and after the procedure.
So knowledge is power when it comes to gallbladder issues.
Absolutely.
Now, you mentioned earlier that pancreatitis can be a complication of gallstones. That sounds pretty serious. Can you tell us more about what pancreatitis is and how it relates to the gallbladder?
Sure, acute pancreatitis is a sudden inflammation of the pancreas.
Okay.
And you're right, gallstones are often the cause. Remember those bile ducts we talked about?
Yeah.
Well, they share a pathway with the pancreatic duct, which carries digestive enzymes from the pancreas. If a gallstone gets stuck in this common pathway, it blocks both the bile duct and the pancreatic duct.
Ah, so it's a double whammy,
Exactly.
blocking both bile and those digestive enzymes. What happens when those enzymes get backed up like that?
Instead of flowing into the intestines
Yeah.
to digest food, they start digesting the pancreas itself. It's called autodigestion,
Oh, wow.
and it triggers a massive inflammatory response,
Yeah.
causing really severe pain, usually in the upper abdomen, often radiating to the back.
That sounds incredibly painful. Are there any other red flags to watch out for?
Definitely. The pain often comes on suddenly and intensely, frequently after a heavy meal or drinking alcohol. You might also see things like abdominal distension, bruising, nausea, vomiting, fever, even confusion.
Wow. That's quite a list. So if you have any of those symptoms, especially after a big meal or a night out, it's time to head to the ER.
Absolutely. Early diagnosis and treatment are vital. Doctors will use imaging like CT scans, MRIs, ultrasounds, and blood tests to measure levels of pancreatic enzymes to confirm the diagnosis.
Okay, and once pancreatitis is diagnosed, what's the plan of action?
The main goal is to give the pancreas a chance to rest and heal. So nothing by mouth is crucial in the early stages.
Makes sense.
Medications are used to manage pain, control nausea and vomiting, and provide fluids and electrolytes.
So it's all about supporting the body while it fights back against the inflammation.
Precisely. And nursing care is really critical here. Nurses are the ones managing pain, making sure the patient stays hydrated, helping them breathe easier, through positioning, monitoring for complications, providing education and emotional support.
Yeah, they really are the unsung heroes of healthcare.
They are.
Now, you mentioned that sometimes tumors can also cause pancreatitis, which brings us to our next topic, oncology emergencies. This sounds pretty heavy. What are we talking about here?
Oncology emergencies are acute, life-threatening situations that happen in people with cancer. They require quick action and treatment to prevent things from getting worse.
So this is when cancer takes a sudden turn for the worse.
Exactly. One example that can be particularly scary is superior vena cava syndrome, or SVCS.
What makes SVCS so dangerous?
Well, the superior vena cava is a major vein that carries blood from the head, neck, arms, and upper chest back to the heart.
Okay.
In SVCS, a tumor, usually from lung cancer, presses on and blocks this vein. This causes blood and fluid to back up in the upper body.
So it's like a traffic jam in
Yeah.
the circulatory system.
Yeah.
And everything north of the heart gets all congested.
Exactly. And the symptoms can be pretty dramatic. Swelling in the face, neck, and arms, shortens breath, coughing, headaches, even changes in mental status.
That sounds terrifying. How do they treat that? Is it a surgical emergency?
The treatment really depends on what caused it and how bad it is.
Okay.
They might use radiation therapy or chemo to shrink the tumor. Medications can help with things like the swelling and blood clots. In some cases, they might put in a stent to keep the vein open.
So the goal is to relieve that pressure on the superior vena cava
Yeah.
and get the blood flowing again.
Exactly.
You mentioned lung cancer as a common culprit in SVCS. Are there any other types of cancer that can cause this?
There are,
Yeah?
though it's less common, lymphoma. Cancers of the thymus gland, which is in the chest, those can cause it too.
Mhm.
Sometimes cancers that have spread from other parts of the body can metastasize to the chest and cause compression.
So cancer can be sneaky and unpredictable.
Huh?
Let's move on to another oncology emergency, spinal cord compression. What makes this one so serious?
Spinal cord compression is a real medical emergency
Okay.
because it can quickly cause irreversible damage to the spinal cord, leading to paralysis, loss of sensation,
Yeah.
and even loss of bowel and bladder control.
Sounds like every minute counts.
It does.
What usually causes this?
Most of the time, it's caused by cancer that's spread to the bones around the spinal cord. These cancerous tumors grow, and they press on the spinal cord, disrupting the way signals travel.
So it's like there's a rogue construction project happening in the spine, and a tumor's encroaching on those nerve pathways.
That's a great way to put it. The symptoms often start with back pain that's worse at night or lying down.
Okay.
As the compression worsens, you might see weakness, numbness, tingling in the arms or legs, difficulty walking, problems with, bowel or bladder control.
So those are some serious red flags. How spinal cord compression diagnosed and treated?
MRIs are the best for diagnosis. They give those detailed images of the spinal cord and the surrounding structures. The treatment, it really depends on the cause and how severe it is. But they often combine radiation therapy, surgery, and meds to reduce swelling and pain.
So it's a multifaceted approach to relieve that pressure on the spinal cord and prevent further damage. Now let's move on to another oncology emergency. This one involves an important electrolyte, hypercalcemia. Can you remind us what hypercalcemia is and why it's so dangerous?
Hypercalcemia means there's just too much calcium in your blood, and it can be a life-threatening complication of cancer. Calcium plays a vital role in lots of bodily functions, things like muscle contraction, nerve function, blood clotting.
Right.
But when the levels get too high, it can really disrupt these processes, leading to a whole bunch of problems.
So it's like a delicate balancing act.
Uh-huh.
Too much calcium throws everything off.
Exactly. Think of it like calcium is the conductor of an orchestra.
Okay.
When it's just right, everything works in harmony. But when there's too much, the music gets chaotic and just, well, off.
I like that analogy. So how does cancer cause this calcium overload?
Certain cancers, especially those that spread to the bones, they can release substances that make bones break down and release calcium into the bloodstream.
So the cancer is kind of hijacking the body's normal calcium regulation system?
Exactly. And as those levels climb, the symptoms become more and more noticeable. You might see fatigue, weakness, confusion, nausea, vomiting, constipation, increased thirst, even heart rhythm problems.
Sounds like high calcium can cause problems all over the body. How do they treat that?
Treating hypercalcemia involves, first, addressing the underlying cancer, of course,
Okay.
but also taking steps to lower the calcium levels directly. That might mean giving lots of IV fluids to dilute the calcium and flush it out, medications to slow down bone breakdown, and in severe cases, dialysis to filter the blood.
So they're coming at it from multiple angles.
Yep.
All right, let's talk about our final oncology emergency for this part of our deep dive. Tumor lysis syndrome, or TLS. This one sounds pretty scary. What's going on here?
TLS is a potentially fatal complication.
Okay.
It can happen when cancer cells are destroyed really rapidly, releasing their contents into the blood.
What happens when all this cellular debris floods the system?
Imagine a dam breaking. A sudden rush of potassium, phosphate, uric acid overwhelms the body. It just can't filter and process all these substances. And these electrolyte imbalances can then mess with the function of vital organs, especially the heart and kidneys.
So like a toxic overload.
Exactly. The symptoms can vary a lot because they reflect all the different systems affected. You might see fatigue, nausea, vomiting, muscle cramps, seizures, changes in heart rhythm, decreased urine output.
So it affects the whole body. What kind of cancers are most likely to cause this?
TLS is most commonly seen in cancers that respond really well to chemotherapy.
Okay.
Like acute leukemias and high-grade lymphomas. It's kind of paradox. The treatments that are meant to kill the cancer cells can sometimes trigger this dangerous complication.
It's a reminder of how complex cancer treatment really is and how there's a need for constant vigilance.
Definitely.
How do they manage TLS? Is it reversible?
Early recognition and aggressive treatment are key. Hydration's crucial because it helps dilute those high levels and supports the kidneys. They also use meds to lower potassium, bind phosphate, and reduce uric acid production.
So it's a race against time to rebalance those electrolytes and prevent organ damage.
It is, and in serious cases, they might need to do dialysis to filter the blood and get rid of those excess electrolytes and waste.
Sounds really intense for patients and their families. What role do nurses play in managing this?
Nurses are absolutely essential in recognizing the early warning signs,
Okay.
monitoring those electrolyte levels,
Yeah.
and providing supportive care to those patients who are often really sick.
They're the eyes and ears on the ground, making sure patients get the care they need. We've covered a lot in this first part of our dive, from troublesome gallbladders to the complexities of oncology emergencies. But before we take a break, is there anything that stood out to you about these conditions? Any common threads?
You know what's really fascinating to me is how these conditions, while seemingly different, they all highlight just how delicate the balance is within our body systems.
That's true.
Whether it's a gallstone messing with bile flow or a tumor wreaking havoc on electrolytes, it really underscores how interconnected everything is and how even small disruptions can snowball into bigger problems.
It's a reminder that we're not invincible, even with all our fancy medical advancements. But speaking of advancements, are there any promising developments on the horizon for treating these conditions? Are we getting better at preventing these emergencies or catching them earlier?
Oh, absolutely. There's a lot of exciting research going on. For gallstones, for example, they're exploring new ways to detect them earlier, even before they cause symptoms. And they're developing medications that could dissolve them more effectively and even prevent them from forming in the first place.
So, staying one step ahead of those pesky stones.
Exactly.
What about oncology emergencies? Anything that gives you hope for the future?
There are some truly groundbreaking advancements in cancer treatment, things that are really changing the game when it comes to managing these emergencies. One area that's particularly exciting is immunotherapy,
Oh, yeah.
which uses the power of the body's own immune system to fight cancer.
I've heard about that. It's like turning the body's natural defenses into a superpowered army against the cancer. How does it actually work?
It's a bit complex,
Okay.
but the idea is that these immunotherapy drugs work by either boosting the immune system's ability to recognize and destroy cancer cells, or by removing the brakes that cancer cells use to, hide from the immune system.
So, like giving the immune system a pep talk and some high tech weapons,
Yeah.
and at the same time, you're disarming the enemy.
Yeah, that's a great way to put it. And the results have been amazing. Immunotherapy has shown huge promise in treating a lot of different cancers,
Hmm.
leading to long-term remissions and even cures in some cases.
That's incredible. Sounds like a real paradigm shift in cancer treatment.
It is.
What about those targeted therapies I hear so much about? Are they living up to the hype?
Targeted therapies are another game changer. Unlike traditional chemo, which attacks all rapidly dividing cells, both good and bad, targeted therapies focus on specific molecules or pathways, things that are essential for the cancer to grow.
So it's like a precision strike,
Yes,
taking out the cancer's weak spot while leaving the healthy cells alone.
perfect analogy. And we're seeing really incredible results with these targeted therapies in lots of cancers. For example, there are drugs that target specific proteins involved in cell growth, drugs that block blood vessel formation to starve the tumor, even drugs that deliver toxins directly to cancer cells.
Wow. It's amazing how sophisticated these treatments are becoming. But let's not forget about the human element here. We've talked a lot about the technical aspects of these conditions, but what about the emotional and psychological impact they have on patients and their families? What kind of support do they need to navigate these really difficult situations?
That's such a crucial aspect, and it often gets overlooked. These conditions can be terrifying and overwhelming, both for the patients and their loved ones.
Of course.
They need more than just the medical treatment. They need emotional support, clear communication from their healthcare team, access to resources that can help them cope with all the challenges they're facing.
So it's about treating the whole person, not just the disease.
Right.
What can healthcare professionals do to provide better support in these situations?
Well, it starts with just listening to the patient, acknowledging their fears and concerns, and answering their questions honestly and compassionately. It's about explaining things clearly in a way they can understand, empowering them to make informed decisions about their care.
So building a relationship of trust and mutual respect.
Exactly. Patients need to feel like they're part of the team, not just, passive recipients of treatment. And that takes open communication, shared decision-making, recognizing their individual needs and preferences.
It makes sense. When you feel heard and understood, it's easier to face those challenges. Let's shift gears a bit and revisit some of those specific conditions. Earlier you mentioned ERCP being used to treat a variety of problems in the bile ducts and pancreatic duct. Can you walk us through what actually happens during that procedure and why it's so versatile?
Imagine a tiny submarine navigating through your digestive system,
Okay.
equipped with lights, cameras, even tiny tools. That's essentially what ERCP is.
I'm intrigued. How does this tiny submarine get into those ducts?
They insert a thin, flexible tube with a camera through your mouth, down the esophagus into your stomach, and duodenum.
The duodenum, that's the first part of the small intestine, right?
Yep, that's it.
Okay.
From there, they maneuver the scope into the opening of the bile duct or pancreatic duct.
So they're threading a needle through the digestive system.
You could say that.
What happens once the scope's in place?
That's when the real magic happens. Using tiny instruments attached to the scope, doctors can do a whole range of things. They can remove gallstones blocking the ducts, open up narrow or blocked areas, take biopsies to diagnose things, and even place stents to keep the ducts open.
Like a high-tech plumbing job, but on a microscopic scale. No wonder it's considered such a valuable tool in managing these disorders.
It is, yeah. It's amazing what they can do with these minimally invasive techniques.
I know we focused a lot on the serious side of these conditions, but Are there any lifestyle changes people can make to support their gallbladder and pancreatic health? I'm always a big fan of prevention.
That's a great question. You can't always prevent these conditions, but you can definitely lower your risk and just support your overall digestive health.
So, what are your top tips for a happy gallbladder and pancreas?
Well, for the gallbladder, maintaining a healthy weight is huge.
Okay.
Obesity is a major risk factor. What you eat matters too. A diet rich in fruits, veggies, whole grains, low in saturated and trans fats can really help.
So, basically, eat your veggies and ditch the junk food.
Exactly. As for the pancreas, avoiding too much alcohol is key.
Okay.
Alcohol can trigger inflammation and damage the pancreas over time, increasing the risk of pancreatitis.
Moderation is key. Are there any other lifestyle factors?
Yeah. Staying active and managing stress can benefit both the gallbladder and pancreas.
So, all those healthy habits we should be doing anyway.
Exactly.
Now, before we move on, I wanted to touch on patient education. What are some key things that patients need to know about managing their conditions and preventing complications?
Knowledge is power, especially when it comes to your health.
Right.
Patients need to understand their diagnosis,
Uh-huh.
the potential risks and complications,
Okay.
and the treatment options available to them.
So they need to take an active role in their own care.
Absolutely. Patients who are informed tend to have better outcomes. They're more likely to stick to their treatment plans, recognize those early warning signs, and get help when they need it.
It makes sense. When you're part of the team, you're more invested in the plan. What specific info should patients be armed with?
Well, for gallstones, they need to understand the risk factors, the symptoms, the lifestyle changes that can help prevent future problems.
So knowing those 4 F's is crucial.
Definitely. And for pancreatitis, it's important to understand how alcohol and diet can trigger it, the importance of getting medical help right away, and the possibility of long-term complications.
So know your enemy and have a battle plan. What about those facing the oncology emergencies? What can help them?
They need to be aware of the potential complications from the cancer and its treatments,
Okay.
the signs and symptoms of those emergencies, and how important it is to get immediate medical help if they notice anything concerning. They should also know about the resources available, things like support groups, counseling, financial assistance.
So you're giving them a roadmap and a safety net.
Exactly. Knowledge and support can make a big difference.
I know we've covered a lot, but before we move on, I want to highlight something you've emphasized. The vital role nurses play in managing these conditions.
Yes.
They're on the front lines, providing care, education, support to patients and their families.
Absolutely.
What are some of the unique challenges they face?
Nursing in these areas requires a really unique combination of knowledge, skill, and compassion.
Uh-huh.
One of the biggest challenges is dealing with the emotional toll of caring for patients who are often facing very serious illnesses.
It must be incredibly difficult to see that suffering day after day.
It is. Nurses are incredibly resilient, though. They find ways to focus on providing the best care while acknowledging their own feelings.
Sounds like emotional intelligence is just as important as their clinical expertise.
Oh, definitely. Nurses also need to be great at communicating complicated medical info to patients and families, often in very stressful situations. They're educators, advocates, sometimes even counselors, providing comfort and guidance during some of life's most difficult moments.
It's a demanding job. We should all be grateful for the nurses who dedicate themselves to this work.
I agree, they're the unsung heroes of healthcare.
Now, before we wrap up this part, I want to go back to the interconnectedness of the body.
Yes.
We've seen how a gallstone can set off a chain reaction and how cancer can disrupt those systems in big ways. Makes me wonder, are there connections between these conditions? Could having gallbladder problems increase the risk of certain cancers? Or the other way around?
That's a really interesting question. It really gets you thinking about, like, those domino effects one health issue can have on the whole body.
Right. So is there any evidence to suggest a link between, gallbladder problems and cancer?
It's an area of ongoing research, and while we don't have definitive answers yet, some studies do suggest there could be connections.
Okay.
For instance, chronic inflammation of the gallbladder.
Uh-huh.
That's called chronic cholecystitis. It's been linked to a higher risk of gallbladder cancer.
So it's like that smoldering fire we talked about
Yes,
earlier.
exactly.
That could eventually turn into a bigger problem.
Exactly. And there's even some evidence that having your gallbladder removed might slightly increase the risk of certain gastrointestinal cancers down the line.
Oh, wow, that's surprising. Why would removing the gallbladder have that effect?
It's not totally clear, but one theory is that, When the bile flow changes after gallbladder removal,
Uh-huh.
it might alter the gut microbiome. That's the community of bacteria in our intestines.
Right.
And these shifts could potentially contribute to cancer development.
Wow, it's amazing how interconnected everything is. The gallbladder, the gut microbiome, even cancer risk really highlights the need for a holistic approach to health, considering how all these factors interact.
For sure.
But let's shift gears a bit and go back to those oncology emergencies. We talked about some promising new treatments like immunotherapy and those targeted therapies, but what about prevention? Are there any lifestyle changes or early detection strategies that could help, reduce the risk of these emergencies?
That's so important. While we can't always prevent these things from happening, there are definitely things we can do to lower our risk and improve our overall health, of course.
Okay, so what are your top tips for staying ahead of those oncology emergencies?
It all starts with the basics. Not smoking, maintaining a healthy weight, eating a balanced diet, lots of fruits, veggies, whole grains, and limiting alcohol.
So all those healthy habits we always hear about actually do matter.
They really do. And it's important to stay current on those recommended cancer screenings. Early detection is huge when it comes to cancer.
Okay.
It's much more treatable in the early stages.
So talk to your doctor about those screenings and don't skip them.
Definitely. If you have a family history of cancer, you really got to be vigilant about those screenings. And talk to your doc about your risk factors.
You mentioned earlier how critical nurses are in managing these conditions and supporting the patients and families.
Oh, absolutely.
What are some ways they're going above and beyond to improve care in these areas?
Nurses are constantly innovating, finding new ways to make things better for their patients, even when things are tough.
Okay.
For example, many nurses are getting certified in specialized areas, like oncology or critical care, so they can provide more focused expert care.
So they're like specialists within a specialty.
Exactly. And they're taking on leadership roles, developing and implementing new protocols and procedures
Yeah.
to get better outcomes for their patients. They're involved in research, education, advocacy, really pushing the envelope in patient care.
It's inspiring to see nurses leading the way, shaping the future of healthcare.
They are true champions for their patients.
Before we move on to the final part of our deep dive, I want to go back to something you said earlier, the interconnectedness of the body's systems.
Yes.
We've talked about how a gallstone can trigger a domino effect
Uh-huh.
and how cancer can disrupt things in really profound ways. It makes you wonder, are there any connections between these seemingly different conditions? Could having a history of gallbladder problems increase the risk of certain cancers? Or the other way around?
It really is. It makes you think about all those ripple effects that one health issue can have on the rest of the body.
So is there any evidence to suggest a link between gallbladder issues and cancer?
It's something researchers are still looking into. There's no definitive answer yet, but some studies do suggest there could be connections.
Okay.
Like, for instance, chronic inflammation of the gallbladder. It's called chronic cholecystitis.
Right.
That's been linked to a higher risk of gallbladder cancer.
So that smoldering fire that we talked about earlier
Yes, good
could
idea.
eventually ignite something bigger.
Exactly. And there's even some evidence suggesting that, having the gallbladder removed might slightly increase the risk of some gastrointestinal cancers later on.
That is surprising. Why would removing the gallbladder have that effect?
It's not entirely clear, but one theory is that those changes in bile flow after the gallbladder is gone might affect the gut microbiome.
Right.
That community of bacteria in our intestines.
Yeah.
And those shifts could potentially play a role in cancer development.
It really is fascinating how connected everything is. The gallbladder, the gut microbiome, cancer risk. It really highlights the need to look at health holistically, considering all these factors, how they all play together.
Absolutely.
But let's shift back to those oncology emergencies for a bit.
Yeah.
We talked about some promising new treatments like immunotherapy and targeted therapy. But what about preventing these emergencies? Are there lifestyle changes or early detection things that can help reduce the risks?
That's a great question and a really important one. While we can't always stop these emergencies from happening, there are definitely things we can do to lower the risk
Okay.
and improve our overall health, which is always a good idea.
So what are your top tips for staying a step ahead of these oncology emergencies?
It all starts with the basics, really. Not smoking, maintaining a healthy weight, a balanced diet with plenty of fruits, vegetables, whole grains, limiting alcohol intake.
So all those healthy habits we always hear about, they really do make a difference.
They really do. And staying up to date on recommended cancer screenings is crucial. Early detection is key with cancer
Right.
because it's often more treatable in the early stages.
So talk to your doctor about those screenings and don't skip them.
Exactly. And if you've got a family history of cancer, you got to be extra vigilant about those screenings. And talk to your doctor about your risk factors.
Now, before we wrap up this deep dive, I want to circle back to something you've emphasized throughout our conversation: the amazing role nurses play in managing these complicated conditions. They're the ones providing care, education, and support to patients and their families. What would you say is the one thing you wish everyone knew about these conditions?
That's a good question. If I had to choose one message, it'd be this. Listen to your body. Trust your instincts. And don't be afraid to advocate for yourself when you're dealing with healthcare. If you're experiencing symptoms that are unusual, especially if they stick around or get worse, get medical attention right away.
That's important.
Early detection and intervention can make a huge difference.
Those are powerful words. Knowledge is power. And knowing the signs and symptoms can empower us to take action and get help when we need it.
Well, I want to thank you for sharing your knowledge and insights with us today. It's been a really eye-opening conversation.
It's been my pleasure. I always enjoy diving into these topics and exploring all the latest developments in medicine.
And to our listeners, thank you for joining us on this deep dive into the world of biliary disorders and oncology emergencies. We hope you've come away with a better understanding of these conditions, a deeper appreciation for all the incredible healthcare professionals out there, and maybe even a little spark of curiosity to keep learning. Until next time, keep exploring.